Hello, my name is Kelly Mills, and I'm an MSN student at Eastern Kentucky University. Today, I'll be presenting my integrative review presentation for NSC 890. Also, I am a nursing unit manager at a nursing home, so I have great experience with the elderly population. The topic I have chosen is the effect of music intervention on depression in the older adult population. I chose this topic after reviewing the National Institute of Nursing Research Strategic Plan for 2011. One goal was to improve quality of life by managing symptoms of acute or chronic illness. Depression fits this goal because it could be both an acute or chronic illness, and it has a great effect on quality of life. Variables for this review were determined after reading Murock and Higgins' theory of music, mood, and movement to improve health outcomes. I chose specifically the older adult population after reading the Geriatric Mental Health Foundation statistic that 15 to 20% of those over the age of 65 have experienced depression. Risk factors for this population include comorbidities, socioeconomic status, physical limitations, decreased social interaction, cognitive dysfunction, and being on multiple medications. Multiple medications put you at a greater risk for depression because depression could result as a side effect to one of these medications. Also, this population is a greater risk at being widowed, and those who are widowed lose an important social support system. To be included in this review, studies had to be published in the last 10 years, petitions had to be greater than 55 years old, they could be male or female, and residence was not taken into consideration. So I included studies that had a setting in the nursing home or out in the community. Study 1 was performed by Mohammadi, Shahabi, and Panal. 90-minute sessions of music therapy were given weekly times 10 weeks. There were 19 participants that were randomly allocated to the control group or the experimental group. All participants were over the age of 65, and the 21 Depression Anxiety Stress Scale was used to analyze depression levels before and after the music intervention. In Study 2, Chan et al. 2011 completed 30-minute weekly sessions times 8 weeks. The control group had a 30-minute rest period, and the Geriatric Depression Scale was used before and after the music intervention. In Study 3, Chan et al. 2009 also did 30-minute weekly music therapy sessions that lasted 1 month. There were 47 participants, all over the age of 60. Control groups was also given a 30-minute rest period in place of music intervention. Also, the Geriatric Depression Scale was also used to measure depression in this study. Study 3 had measured blood pressure, pulse, and respiration in addition to depression. Study 3 found that depression had a significant change as well as respiration and pulse after music intervention was initiated. Study 1 and 2 agreed that there was a significant change in depression after music intervention. I do believe there is enough evidence to implement music therapy into practice. There are several benefits to music therapy, one being that it's cost effective, 2 being that it will not interfere with other treatments, 3, it's easy to implement on your own, and it's portable, so you can listen to it on your way to work, and that it would be easy to comply with. The location that I would choose to implement this intervention would be in the nursing home setting. In this location, you have the potential for social interaction by making the music intervention a group therapy, and also you have a greater chance of compliance by making it an activity, and you could post the activity schedule for participants to see.